So I've drawn out the medication and I've done all of my med checks, so I'm ready to administer the medication. So first I'm going to assess the site. I'm looking for redness or swelling. Because he already has IV fluids infusing, I don't need to flush beforehand, but if he did not, I would want to make sure to flush the line and make sure there's no swelling. I'm going to pause the IV fluids, take my alcohol swab, and give the port closest to the IV site a good scrub for 15 seconds. I'm going to kink the line just above the port to make sure it doesn't go backwards. Remove the needle and attach my medication. I will give this medication over 30 seconds because I looked it up ahead of time, and that's over how long it should be pushed. Now that the medication is in, I am going to take my flush, attach it to the port,
and I'm going to flush at least 4 milliliters because I am going through the port on IV fluids. If I was not going through IV fluids and just going through the Luer lock, I would need to flush with at least 2 milliliters. So 4 milliliters if I'm infusing through IV tubing, 2 milliliters if it's saline locked. And that is to make sure that none of the medication is in the tubing and that all of it gets into the patient. Because I did my 2 mils over 30 seconds, I am going to take 1 minute to do my 4 mLs that I need to flush after the medication. This way I'm doing it at the same rate as the medication.
So now that my flush is in, I can put my needle in the sharps and I restart the pump. Okay, so you let me know if you have any of the side effects that I talked about before, and we'll get you covered back up. Put the side rail back up. Here is your call light, and I'll lower the bed back down. And you let me know if there's anything else you need.